Welcome to Med Medicine with Miss P. Happy New Year. I took a month off from filming, not from work and life and everything else that could have driven someone insane in the past month, but I just didn't have time to do my 15-minute video. I know that sounds crazy, and I have plenty of content. I just couldn't do it. I just had a million other things going on. I've been working extra and lots happening, but the good news is, since I haven't done a video in a while, I have lots to add to it. And oh my gosh, you can't, even if you try to go there with your brain, especially if you're in the field, you can't make this stuff up. There shouldn't even be empty boxes. There should just be like multiple choice. It should all be just yes and no. And then if I'm interested, I'll ask. If I'm not, you don't need to go on. In fact, when you're filling out your health history online, and I know it's not just for our facility, but any facility that you go to or any doctor's office, there's got to be like a little tiny part of you, just a little bit, that can understand how to do that correctly. So if it says like medication, dose, route, and frequency, you have to know that where it says medication, there's no S. You just put the one medication in there. So when you write it in paragraph form and you have 50 different medications in there, that doesn't help us at all. And then when you try to match up the doses in correlation to the med, and then you scroll down and you see that green button that says add medication, that's where you're supposed to put the second medication, not the 30-second, the second medication. So your little paragraph form of allergies, medications, and surgeries, none of that is helpful. We just have to go in there and erase all of that crap and start all over. So please stop doing that for everybody. I mean, chances are you're not coming to my facility, but do it for all of us out there. And also, when you're listing your medications and surgeries in one box, which I won't ever completely understand, telling me that you wear your seatbelt, that's irrelevant. Like completely irrelevant. Patient literally wrote in there, and I wear my seatbelt all the time. I don't know what to do with that. When it says, have you seen a cardiologist for anything specific in the last so long, or in the last, or ever, even if it just means in your life, if you say yes 20 years ago for some palpitations, but they couldn't find anything because it was related to your chocolate or caffeine intake, that's also irrelevant. There's no reason to mention that at all. It's maybe one of the dumbest things I've ever heard someone say. If it was 20 years ago and they didn't find anything, do anything about it, do you really think it's worth mentioning right now? And I know you think, well, I don't want to leave anything out. Sometimes it's okay to leave some stuff out, some completely ridiculous, irrelevant stuff. Like my poor coworker that's there right now listening to a 72-year-old man talk about ejaculation and his Viagra use. No medical professional needs to hear that unless it's maybe your urologist or your therapist. We don't need to know that at all, and that is revolting. So could you just not? I don't care if you're 26 or 76. Just don't talk to us about that at all. We didn't ask. I assure you, we did not ask. So I'm not sure why she had a 26-minute conversation about Viagra. It's infuriating. And in that little box, that box I hate with such a passion, because people don't understand it. It's a really nice thing to know. What can we do to make your stay here better? We do want to know that. We'll do anything we can to make this visit better. But when you write something in so ridiculous that it makes us all want to cry, oh, please stop. So this patient wrote in, what can we do to make your stay better? This surgery must be confirmed with the patient and the doctor before surgery. You mean a timeout? You mean do a timeout? Like the law, like JCO insists we do a time. We're going to do a timeout. You writing stuff in that box is not going to change our processes. That box is specifically to know what we need to do to help you versus another individual because of your specific problem. Maybe you have a back or neck problem, and I know you have sinus drainage, and I know you have back pain. You don't want to know how I know that? Because you're human. And every human I come in contact with can't lie back because of their sinus drainage. Or you can just suck the snot up in the back of your throat throughout the entire procedure so I can hear it in stereo. That's, you could do that. I ask you not to, but you could do that. And we know your back hurts because most of the procedures we do here are for back pain. So you don't have to tell me that. Tell me something like you have a frozen shoulder and you're not able to roll. You know, that those are the things that we need to know. Um, and also in that box, if you're asking for the cost or your coverage by insurance, surely you recognize when every single thing from the time you fill your name out to the very last portion of this 200 question essay, basically, when you recognize that's all medical health information, surely there's a little tiny part of you that recognizes this is not where we discuss insurance. Nor would you ask me about your insurance. You all do, and I don't know, and I'm never going to know. And if ever my job requires me knowing, like it has in the past, I will quit that job and move to a job that is a nursing job because I don't deal with insurance. We have special, very educated and experienced people to do that, and I'm not one of them, and nor will I ever be. Oh, this was one of our favorites. I think my previous coworker who ditched me to go do home health closer to her family, I think she found this one, penicillin and the reaction. She's allergic to penicillin. That's fine. Her reaction is itching from within. I don't internal itching. I don't. Maybe she means a yeast infection. I don't know where the within itching comes from. I'm assuming she means yeast infection, thrush. I don't. Do you think her peritoneum or her thoracic cavity itches? I don't know, itching from within. All right, no penicillin for you. Um, Digestive disorders. Yes, this person said, we asked you, do you have any digestive disorders? And they said, yes, lactulose or lactose, probably lactose. Again, we're not going to feed you any milk or anything like that. That's not a digestive disorder. That's an entirely different video we could go into of why everybody can't eat peanuts, can't drink milk anymore, and has all kinds of disorders that didn't exist 40 years ago. But that's a different video. We're not doing that today. Also, if you write in there gas, do you have gas? We don't need to know that. We'll figure that out all on our own. Despite our medical masks that seem to be able to stop a airborne aerosol virus, we can still smell if you have gas. So you don't need to tell us that at all. Thank you for the heads up, though. Also, random body parts are not surgeries. You know, when you say arm, like in that little box where we ask for your surgery, you say right arm, that's not a surgery. That's just a part of your body. And you say nose, again, that's just a part of your body. When you put in appendix, I'm assuming you mean appendectomy. I don't think we repair any appendixes, but could you just write in the name of the surgery that you had? And you have a computer in your hand that can translate any language in the world. So surely you can spend just like 11 seconds looking up what the name of your surgery is so you have an idea of what it was. And I assure you it wasn't a rotary cup. No one messed with your rotary cup. Carpet tunnel. She had her carpet tunnel surgery. That was really nice. Yes, someone else said with tetracycline, their allergic response was an internal reaction as opposed to external, and vision loss. I guess that's possible. I haven't heard of that one, but okay. Oh, one of my favorites. Have you ever had MRSA? Yes. Where? Tucson, Arizona. Okay. All right, we'll call our people in Tucson and take care of that previous MRSA problem you had. Where on your body was the MRSA? Because if you just tested positive from a nasal swab, that's much more different than it like was septic. You know, like the patient yesterday that said in bloodstream. That's a little more important. Not nearly related to where in the country or where on the planet you were when you got the MRSA. Nobody cares about that. And while we're at it, if I could get you to stop telling me the name of your doctor, the surgeon, and the name of the facility you had your previous surgery, nobody cares about that either, not even a little bit. I don't care that this doctor redid your knee and your this cardiologist put your pacer in, but you see that cardiologist regularly. Stop it, just please. Just I only have so many minutes. I have to talk to like 50 people a day. If you could stop that, that would be super helpful. This other patient says that she's allergic to gas because she's going to pass out. I'm assuming she means medical grade gases that we use, like nitrous or maybe Forane or Sugarfane, you know, those medications that are specifically designed to make you pass out. That's what they do. That's the gas you breathe to stay sleeping during anesthesia. It's not an allergy. It's not an adverse reaction. It's a desired result. So if you could stop that, that would be helpful. Like when you tell me that Demerol or morphine, you know, makes you crazy, hallucinate, or you know, go out of your mind or whatever it is, they're narcotics. That's why people take them, so they could be out of their mind. I feel like that's self-explanatory nowadays, but it's not. So there you go. Now everybody knows. Allergic, empty reaction, attached nerves. Yes, that's what they put in for allergy. She wrote in empty reaction and it attached the nerves. What medication is she referring to? I don't know. That's what they write in there. And we just have to decipher it. We're magicians, really, if you want to know. Also, if you're going to have your deviated septum fixed, it is not septrum surgery. There's no TRUM anywhere in your septum. And it's not nasal deviation reconstruction. It's called a septoplasty. Look it up in your phone. It's one word. You can make it into 10 words if you want to, but it's really just septoplasty. That's all there is to it. One of my favorites, umbilical cord hernia. Where was your hernia? It was at the umbilical cord. I'm sorry, sir. I see here you're 56 years old. Do you still have your umbilical cord? Because if so, I'm assuming it's pressed together in the pages of some sick book you keep. Otherwise, there would be no reason that a 56-year-old man would still have an umbilical cord. Are you trying to say an umbilical hernia? Which, not to be confused with the biblical hernia, which you can get in church if you praise hard enough. Wisdom teeth, right. If you have your wisdom teeth removed, I assure you they were not under an epidural. You did not have them removed via epidural. That's not a thing. And your C-section definitely wasn't under local. The amount of local it would take would be a toxic amount. You would die from the local before you could complete the C-section. And when you say you had a watchtower implanted, now listen, I don't know everything about everything that we implant, but I'm going to bet that's a Watchman. Now, if there is a watchtower, please comment below because I would like to know where said tower goes. Maybe that's slang for penile implant. I don't know, but I'm pretty sure they meant Watchman, watchtower surgery. That's what they had. Oh yeah, there's no. I can't pronounce this mainly because it doesn't exist. So this one I'm going to write down for you. This is a medication that he takes for his stomach. Can you see that? Uh-huh. Anybody know what that is? Uh-huh. Potrazolos. Uh-huh. Yeah, that's Protonix. Mm-hmm. DRT. That's DRT. His daughter gives it to him. I don't know. That was... Oh, and also, I got another one for you. This is a surgery he had. This may be... God, I can't even... One of my all-time favorites. And I wrote this down literally word for word from how he wrote it. This was one of his surgeries. Uh-huh. Upon questioning, it was his appendix. That was his appendix. Appendilochiosis. Maybe there's an appendage on his appendix. I don't know. I can't. I got nothing for you. Oh, and this lady had a shoulder left removed cervical rib. That's what it said, word for word. Shoulder left removed cervical rib. Just cervical rib removed. That could be a thing. I don't know. It's entirely possible. Oh, You know what? And I don't know what this was. I wrote it down. This could be a medication. This could be a surgery. I never did find out. I think I had to delete it and just waited for her to mention it again. Oh, maybe that's fibromyalgia. And maybe that's what they call it on the streets. I don't know, but I had to just write it down. And then the last one on this particular page of 10 was that this patient had a kidney stone removed from her bladder. So a bladder stone, because once it's in your bladder, it's not a kidney stone anymore. It's in your bladder. It's a bladder stone. It probably came from your kidney. That's possible, but that's not where it is right now. So now it's just a bladder stone. But all right. I only have 4,000 or 5,000 more for you, but as always, I got to get out of here. My son, bless his heart, moved into his own apartment, so be with us because I'm going to go see how much stuff is on the floor from the 3 days ago that he's been staying there. So we'll see what that looks like. And I did go into my daughter's room and her bathroom again. It's almost like an obsession now. I'm drawn to it to see if I still have tears left to cry, really to test a dehydration, I guess, more than anything. I really thought that she was going to be like me, just neat and clean and organized. And I understand. I'm a freak. That's legit. I'm not going to change. I'm not going to lower my standards for anybody. You can eat off my barn floor. I don't think there's anything wrong with that. But her room really takes it to another level. I think the skill and dedication required to destroy a small space like that is it's a talent I don't possess, and I guess I'm grateful for that. But I am going to ground her for the rest of her life. It's that bad. I should put pictures. If I knew how to post pictures on this, I would. And I do have pictures of it on my phone. Because when someone asks, it can't be that bad, and I show them pictures, they just clutch their chest because it's that bad. She hates me. I don't know why. But it's obvious. I'm just really looking forward to her getting her own place. So I'm gonna run on over to my boy's place and see if I can't pee on the floor in front of the toilet and spit all over his mirror. So face your fears, forget your failures, follow your faith, and I'll see you in a week.